So glad that everybody can join us tonight. You are watching School Psych Podcast. My name is Rachel. I'm a school psychologist in Maryland. Excited for tonight's guest. She's a very, has a lot of varied knowledge. And I originally saw her posting a lot on some Facebook groups, and like her responses to questions were just always so insightful. And I was like, I have to get her on the podcast. And luckily she agreed. So really happy for this conversation. But I'm going to pass it over to Rebecca. Rebecca's going to tell everybody how you can participate tonight if you're watching live. Rebecca.
Hi, everybody. I'm Rebecca, and I'm a school psychologist in the state of Florida. And I'm so glad you're here tonight as well. And if you are watching us live, sign into your YouTube account. Even if you came on a little bit past 8, you'll get the live version, streamed live version, and your comments, if you want to ask questions or make comments, will link up right to the video where the conversation is happening. So please feel free to comment alongside your video if you're watching us tonight. And if you're listening later or watching later at another date, the recording, also comments, because the comments stay along with the video and we can continue the conversation over time. You can also, if you want to send us a sort of more private message, you can message us on the Facebook page, School Psyched Podcast page on Facebook, or School Psyched Your School Psychologist, or you can tweet at us if you want to still hang in there on Twitter like we are. And you can use the hashtag Psyched Podcast. So we look forward to, I'll be looking for notifications and look forward to hearing from you tonight. And now I'm going to pass it over to Eric, who's going to introduce himself and our wonderful guest.
All right. Thank you, Rebecca. Well, I am excited to introduce our guest. And my name is Eric. I'm a school psychologist in the state of Connecticut. And we have Dr. Stephanie Nelson with us. She is a licensed clinical psychologist who is board certified in pediatric neuropsychology and in clinical neuropsychology. She provides comprehensive neuropsychological assessments for children, adolescents, and young adults experiencing a wide range of cognitive, developmental, and social and emotional issues. Some examples she helps with include attention and organizational problems, thinking or processing differences, cognitive profiles associated with medical conditions, language or memory difficulties, sensory problems, and other struggles. Dr. Nelson specializes in assessment of very complex children whose multifaceted challenges have been difficult for families or other professionals to navigate and untangle. She also provides autism evals, and her research focuses on improving assessment methods for children with neurodevelopmental disorders and their families, and making sure that reports are clear, comprehensive, and useful for doctors, therapists, and teachers who work with these children. So welcome, Dr. Nelson. We're happy to have you here.
I'm so excited to be here.
It's kind of, to me, super interesting to have a neuropsychologist as a guest, just because I think in school psychology, we often have neuropsychologists, referred to as sort of, the cream of the crop or the gold standard for evals. And so sometimes, lawyers and parents all want neuropsych evals. And so I think it would be great to pick your brain a little bit about what is a neuropsych eval all about? And what are some differences maybe between school psych evals, and when might be a good time to refer, those kinds of things?
Sure. Yeah. As long as we're clear that there's no hierarchy, there are different types of evaluations, but neuropsych evals are in no way better than other types of evaluations. They're just different, slightly different pathway to get to that career point, and then maybe looking at the child through a little bit of a different lens. But we're all just here trying to figure out kids, right?
Yes.
I will say that, yeah, as far as, I get what both of you are saying, but yeah, as far as in the school setting, and maybe that's because sometimes we deal with, so if we're not in private practice, say, where somebody's willingly coming to you and I want this evaluation from you. Sometimes we have parents that, their kid has been referred and maybe they're not so thrilled about it, or they're not, they didn't choose us. So we're kind of there and we're what they get. And so oftentimes we get either lawyers or advocates or angry parents, and no, we don't like what you did there. We're going to go to this other person, and they shop around, and oftentimes it's the neuropsych. And so, we're painted in those contentious situations as kind of like, we're going to go over you type of thing.
Yeah. I honestly think it's one of the tragedies of our field that our evaluations, that some of our interactions end up being like this outside expert versus the school, rather than something that can be much more collaborative, much more just two different professionals looking at the child with maybe a different lens and different pathways to get to the evaluation. But the fact that when you guys invited me on, I'm like, are you sure? Do you guys not do you not hate all neuropsychologists yet? Because I am sure that you have had some of those contentious interactions with neuropsychologists, and I really do think that that's a tragedy. And I hope that conversations like this help bridge some of that gap and help us realize that, like, oh, this is not most neuropsychologists do not think of themselves as like doing a better evaluation or hope that parents will come to us when they don't like what they're getting somewhere else. So just wanted to put that out there.
No, that's like really nice. And I think my difficulty sometimes is trying to explain to parents like what are the differences, and like sort of pros and cons, because I work at a private school, and so often we're referring out for all kinds of testing because we don't do that much in-house. And
Sure.
so when a parent is trying to make a decision between recommendations for an evaluator, between someone who calls their reports psychoeducational evaluations or neuropsychological, sometimes it's hard, even as a person who, a school psychologist who understands and has looked at the reports, it's hard to explain like what is the difference. And so how would you do that? How would you suggest that we do that?
Obviously, the overlap is really high, right? Some of the evaluations that I do, even as a pediatric neuropsychologist, would be better termed psychoeducational evaluations, in the sense that I'm focusing primarily on how the child is doing in the school setting and how they're learning and how I can best support them. And some of my evaluations focus on other topics. So I also see kids with medical disorders. I also see kids with psychological disorders that might only be affecting them at home, or conditions where it's just really complicated. And I'm doing a little bit more than what might be sort of my psychoeducational testing. But really, it's just that I got to assessment a different way. And so I am sort of like, oh, I test kids in sort of any type of setting. Well, where they spend a third of their lives is school. So I end up sort of overlapping with a psychoeducational evaluation. So I always recommend referring to a neuropsychologist if there's a medical thing, right? Because we have specialized training in that. And then maybe if there's something that's affecting the child that the parent's very concerned about, but maybe isn't affecting the child at school, maybe a neuropsychological evaluation would be helpful. Or if you've maybe done some testing or worked with the child in school and you kind of thought you had a sense of it and you're like, oh, this is just still a bit of a puzzle, maybe someone outside who is seeing the child holistically, but outside of the school setting, and just isn't coming with maybe some of the history that you've had with that student or the interactions. Those might all be good reasons to refer, but there's never a good reason of like, oh, it's just better testing.
That's super helpful.
Yes, that really is. I appreciate that. And
I'm wondering, go ahead.
Oh, go ahead, Rachel.
I was just, when I see, so most of my interactions, I don't have many interactions directly with neuropsychs. It's usually, a parent brings me a report, and then we want to kind of integrate this report into, translate it and figure out what this means for the school setting. Does this child need an IEP? Do they already have an IEP? Do we need to update things? Do we need to look at different settings, different placements, different services? Can we meet their needs, etc.? I've seen just a huge variety as far as the the way that reports are constructed, and this is the same with school psychologists too. You know,
Sure.
the quality of reports is what as a neuropsych, like what training, who gets to call themselves a neuropsychologist? Like what training programs? I've heard of things like the Houston conference model. I don't really know one. I wouldn't know one training. If there's if there's preferred training, better training, what certifications do you all have?
Yeah. Well, you know, and there's also confusion about like what a school psychologist means. So people listening to this will understand when I say like it's all kind of complicated. Neuropsychologist is not actually a protected term, so technically anyone can call themselves a neuropsychologist or say that they do neuropsychological testing or neuropsych informed testing, which a lot of school psychologists do, for example, and that's accurate. For people who call themselves neuropsychologists and kind of other neuropsychologists would say, yeah, that's true, or they're eligible for board certification. What they've done is they've gone and gotten their doctorate somewhere, their PsyD or their PhD, then they did their internship, and then they did 2 extra years of postdoctoral fellowship specifically in pediatric neuropsychology. And the Houston Conference guidelines lays out these competencies that we have to meet. We're actually revising those competencies because they're 25 years old now and they are very they're not very relevant to the America that we have now in terms of including diversity and inclusion and multilingual populations and different ways that people get to their path career-wise. So we're revising those and we're going to call it the Minnesota Conference. But people who say Houston Conference guidelines, they mean that 2-year postdoc, they mean these kind of competencies, that sort of thing. So that's who tends to get to call themselves a neuropsychologist. But that postdoctoral placement can be in a variety of situations. It can be in a variety of settings. So some people have trained in a hospital, some people have trained in schools, some people have trained in a private practice clinic, some people have done kind of a hybrid of a lot of those or at a VA or something like that. And that affects the types of reports that they write. So that's part of why you see that wide variety of different types of evaluations. And then there's just like school psychologists, there's not a lot of standards in the field for what a good report is. So some people think a good report is something that's 3 pages long and really succinct and very captures the problem in a lot of jargon, but very few words. And some people write those 50-page ones where you just kind of sigh when you sit down to read them, I'm sure. How are we going to see if this fits? Some neuropsychologists have had tons of training in school settings and with educational law, and others kind of got there because they kept seeing kids and they sort of had to learn on the job. So neuropsychologists also really vary in how much experience they have interfacing with special education law, with school staff, that sort of thing. So some of that, it might help explain why you're like, you know, I like some of the neuropsych reports, but others of them, what is this, please? Is it has a lot to do with our training and what type of experience we had when we got there, and then just general messiness in our fields.
Is there any difference in the way neuropsychologists look at and interpret tests, the same tests that maybe school psychologists use, like, you know, like the Wechsler scales, or is there a difference in the way you look at the scores or the performance on those kinds of tests that we use too?
I don't think necessarily. A lot of times I'm looking at a WISC and you're looking at a WISC and we're seeing a VMI of 85 and we're thinking about what that, a WMI of 85 and we're thinking about what would low working memory mean for this child in the classroom. But I might also be thinking about the functional neuroanatomy or the medical or psychological problem that the person brought in, whereas you're probably going to be thinking more about the classroom implications and what types of services this child might need. We also might have different referral questions. You might be trying to help the team answer the question of, does this child meet the criteria to get an IEP? Whereas that's usually like my 8th consideration. I'm trying to figure out like what the disorder is, what recommendations, that sort of thing. And then I kind of get to that question with the understanding that I have a lot less expertise in that. And mostly I'm trying to kind of get a sense of case conceptualization. So we have maybe different like reasons we're using the tests, but most of the time we're both looking at the WISC and being like, digit spans 7, what might that mean for
Right.
this child?
That's so interesting to also, because Eric and I have been talking about this recently, where a lot of referrals for testing, even before we get to figure out whether they're appropriate or not, it seems as though there's a motivation from whether it's a teacher or a parent, or a belief that the testing is going to be a solution in itself. And so, often for us, it's not, but I wonder, like, might it be if it were a different lens? Like but what you're saying makes sense to me, that if there's a medical question, or it's just answering different questions, though, regardless of the
Right.
different.
And people come to us, to all of us who do testing, with all sorts of questions. And some of them are very obvious. They want to know, is this dyslexia? Or they want to know, does he qualify for special education? But they also have, I'm always talking about, they come in with like secret questions, like they're hoping that the diagnosis or the evaluation process will solve some sort of psychological need that they personally have or that their family has. And sometimes they're like, they don't even know what that is. They just think maybe a diagnosis will help put an end to the struggle. So there is a lot of pressure, I think, and that's common on all of us who do testing, of that other piece of why the family might want the evaluation that goes beyond the diagnosis that we're providing or the eligibility decision we're trying to make.
That's so well said. I think it's sort of, I don't know if I would call it a hidden agenda, and it's probably not even conscious, but right. What is the underlying thing that folks are looking for? And I think that's so important to be aware of, the extra referral question, so to speak.
I do a lot of consultation work where people come to me with cases, and I'm always trying to get, okay, what's the actual question here? And sometimes it'll be sort of vague because the child's already getting services that, all the services they might need, and they've had a diagnosis last year, and you're sort of like, why are we doing testing now? And people will be like, well, they, just want an update. And I'm constantly pushing them, like, what for? Why are we really doing this? Even in the school setting, it's a lot of time, it's a lot of energy. Everybody's filling out a lot of forms. Why are we doing this? And sometimes it's looking for that magic answer, but sometimes it's answering deeper questions about shame or family functioning or loss or grief or hope. And knowing that can go a long way towards us thinking about our evaluations as part of the family's journey over and above the information that we put in so many words in our reports.
I love that you're, kind of gently pushing back against that, because like that's as far as the over testing type of thing. I mean, I all the time, a parent recently brought in a full evaluation and a year ago, and we want another one. And it's kind of like, okay, why? How do you think this one's going to be very different? We're still struggling in this area, Like what is, so yeah, it's, I wanted to ask you, like, going back when you were talking about, the meaning behind scores, like the memory, and block design or things of that nature. We've had a couple guests on, within the field of school psychology that talk about profile analysis, cognitive profile analysis, and scatter doesn't matter, and things like that, that there's a little bit of this discussion. And I don't know if it's within kind of the neuropsych community or if it's just within school psych, but there's a discussion about how useful are those index scores and those subscale scores, and as far as reliability, validity, and actually making predictions about what students are going to be looking like in the real world. Is that a conversation that's going on in your neck of the woods as well, or?
Absolutely. Absolutely. We have lots of scatter doesn't matter versus profile analysis discussions all of the time. Most neuropsychologists are a little bit more on the scatter doesn't matter side, but again, it depends where you were trained. What I always think about is, okay, yes, scatter doesn't matter for some questions, right? So it depends on the question that you're trying to ask. If you're trying to get a sense of generally trying to predict the child's academic achievement, the full scale IQ contributes the largest amount of variance to that, like 50 to 60% of the variance. And that's going to be the most valid for predicting that, whether there's a lot of scatter or not. And if you're trying to answer a specific referral question, the unevenness of the profile may be relevant. It might not, but sometimes it is relevant or helps you understand something unique about the child, assuming you've also confirmed that through record review and talking to the teacher and your interview that you've done and your observations with the child and some other test to confirm it, right? You're not just like, oh, there's a 10-point split here. I've figured it out, right? Um, but it may actually help you understand something about the specific reason that we're here, or some way that the child could maybe use a strength to compensate in the classroom, or some way that you could tailor an intervention that you're trying to do. It may be relevant for that. Is it better for predicting achievement? No, the full scale IQ is clearly the best for that. But it depends on the question that you're asking, I think, right?
I like that. I think I teach a class on assessment in a school psych program, just adjunct. And that's one of the things I'm trying to get my students to recognize is that, the test score on a piece of paper itself tells us just a little bit, but there's so many more things that tell us about the child: the record
Mm-hmm.
review, the observations, the interviewing parents, developmental social histories, and so many pieces, right? And so when we look at that score, it could be a fluke, or it could say, yeah, this is really confirmed by everything we know now. And
Yeah,
that's so important.
exactly. Right? It could be normal variability. It could have been the child was hungry that moment. It could have been you actually kind of administered the test drop. Like it could be so many different things. But if we think about like Haas and Carrier's RIOT model of like records, interview, observation, testing, right? Like testing is 1/4 of it, just 1/4 of it. And I would love it if I could just test a kid and the test scores come back like blood work and I immediately know what's wrong. That would be amazing. And our tests aren't that good yet. The ecological validity of them is not there. The test retest reliability, all of the construct validity, none of it is there yet. So it is one piece. I always say like test scores are an invitation, like an invitation to rethink a hypothesis you might have in mind, or to consider something maybe you didn't consider before, or to get more data to kind of see like, oh, I wasn't expecting that score to be that high or that low. I'm going to test it some more, or see if I can find out more about that. But we can't use them like an X-ray as much as that would be amazing. Right. And I think that's really hard for students because they're so excited about the tests. And honestly, I mean, we're all test nerds, right? Like when you get a new test, like you open it up and you're like, oh, yay, this is going to be the answer. And it just isn't.
I love that. And I hadn't thought, I mean, obviously I'm familiar with the RIOT model, but I hadn't
Yeah.
thought of it in that capacity, that it's, this portion in there. So and we don't give it equal, weight, because
Right.
we want the test scores, and this,
Hmm.
the IEP teams and everybody, they want the test scores and they don't care about the other
Right.
stuff.
And it's so seductive. But if you've ever been in one of those Facebook groups, you see people post blind test scores all of the time, and 20 different interpretations come up. And they all sound reasonable, honestly. One of them you'll be kind of like, but like the other 19 sound pretty good, right? Because test scores could match a lot of different profiles. And they're an invitation to consider those 19 possibilities. But we need the other 75% of our assessment to tell us how to interpret that in context.
I'm just like grinning as you're saying that, because I have had that same experience
yeah,
where you
exactly.
see this whole list and you're like, oh, okay. Like, what? Like,
Yeah.
what? Where are you coming from? I
Like,
just love
oh,
that.
interesting. Yeah. Yeah. Absolutely. Yeah.
You mentioned the case conceptualization process, and I wonder, I'm not sure about all school psychologists, but I know for myself, we didn't, we may have talked about it, and I certainly have done at NASP webinars where presenters shared their versions and formats of how to do that. But now as a student in clinical psychology, we're really going over like, what is that? What do you put into it? How do you do it? How does it make sense? And how can it often not make sense and be useful? But I wonder, for school psychologists out there, if you're watching this whenever, live or later, chime in and let me know if you were taught in a school psychology program how to do that before the referral process, because I wonder if we were to do that, like to understand when before a question becomes a concern, like a teacher says, I'm wondering about why this child's XYZ, or why this child's performance in this class is this way, or whatever. If we were to start to gather data then, like before the official data, I think we might get like a broader range of sources of data, more types of data. Last week we were talking about Hacking Deficit Thinking by Byron McClure and Kelsey Reed, and in that book they talk about the kinds of data we don't typically collect. But I think if we thought of ourselves as doing like a case conceptualization before a question becomes a concern, that could really be helpful. Even if then we do go on to like do a formal evaluation and collect that kind of official data. I don't know. What do you, when I say that, and Rachel and Eric too, do you all have like a case conceptualization process, or do you know about that in school psych? I'm just ask all of you.
I think we have response to intervention or multi-tiered systems of support teams that sort of meet with teachers on varying students who are displaying mild to significant difficulties with reading, math, writing, or behavior. And so I think at least at that level, we do provide recommendations for intervention. And some of these are kids who will stay at that tier 1 level, just needing differentiation in the classroom or some sort of intervention, maybe mild. And some of these kids are kids who just scored low on the current reading evaluation, and with a little intervention in tier 2 support, they stay at that level or move back. So we are trying to sort of use that, I guess it would be a consultation sort of model, and hypothesize what might be going on with the kids. Typically, it's instructional strategies and instructional or behavioral intervention. But but we're trying to do that before they get to that full-blown referral for special education. I think it's new. Our system's been adopting this over the last, 5-7 years, but some of our schools in my system do it really, really well. Probably, like any system, some are still learning the process or working the bugs out.
Yeah. They've done a lot of research in the field of medicine that as we get busier and busier, which I think we can relate to with our medical colleagues, with our busy schedules, we often start replacing the harder, more complicated, more multifaceted questions with the easier question to answer. And we don't even necessarily know we are doing it, but we start thinking, what's the IEP category this child might be under, or what's the diagnosis, or the parents want to know if it's ADHD, so I'm going to answer that. And that question feels a lot easier to answer than wow, this child has overwhelmed the needs of the teacher, the parents. He's very uncomfortable. What are we going to do? Like that feels like a big, hard question to answer. And with our tests and with our time limits, it really is. And so we often just start naturally replacing the question with sort of something that feels easier. And it takes conscious effort, they've found, like real training. I do it a lot with my colleagues where we'll stop and say, okay, now we kind of have a idea. Let's make our playlist. Let's try and think of as many things that could be going on here, even sort of some outside of the box things, just to make sure we're not getting locked into that narrow referral question that's going to bias us and maybe not create a complete picture of the child. Like, let's stop here and see if we can kind of try and expand it a little bit more. Not to like, what's everything that I could possibly know about this child, right? But to something that's a little bit more expansive. There's a little bit more room. There's a little bit more cognitive playfulness and flexibility. And they've found that when you do that, we actually make better decisions. So.
I think that model too of bouncing ideas off of colleagues is
Mhm.
so important. And oftentimes school psychs we're in, we're not around other school psychs. We're in our building. Maybe
Mhm.
I see my other fellow psychs, 4 times a year type of thing. I'm sure that it varies for neuropsychs as far as if you're in private practice alone or in a group. And so I'm sure, yeah, there's a lot of benefit to just talking things through and checking in with others.
Absolutely. And many of us are very isolated. Like when COVID hit, I barely noticed in terms of who I interacted with on a daily basis. Right? I was just still in my office by myself, is seeing one patient at a time. So we have to consciously think about ways to bounce ideas off of our colleagues and kind of create that peer group. And it can't just be, the 3 friends we made in graduate school who think exactly like us. We have to find other people who think about different things, have different expertise, are different from us, challenge us, because otherwise we're really just bouncing ideas off a mirror, which doesn't help us expand, right? Yeah.
I really like that. And just that whole thought about, taking some time to really ask the harder questions or look beyond the surface. I can't even, yeah, we all know how hard COVID has been and how many cases we've had just sort of pile up because of, the impact of COVID and loss of instruction and social and emotional needs. And right, you sort of become like a triage
Mhm.
school psychologist or neuropsych or wherever you are in the field. And being able to take that time is a wonderful opportunity to get to the heart of what's going on with a child. So yeah,
Right.
I appreciate that.
And most of us are so overworked and so underfunded and have such little access to be able to do that. And so it is a luxury. And this is part of why I get so passionate about us writing reports that are faster and easier for us to write, or not just better for people to read, but like actually give us a little bit of that extra time so that we have some of that bandwidth to put back into those questions at the beginning. Because if you're trying to write however many reports you're trying to write a week, it's what we're talking about of taking the time to think about the kid. Sure, at midnight when all the kids are asleep, I guess, right? So part of why I'm so passionate as well about better reports is not just so that we have more of a standard in our field and parents can actually read them, but so that we have some more time to do some thinking. Right.
That's so good. All of what you just said just so resonates with me. And so we're talking about kind of the importance of um, collaboration and consulting with others and really taking our time to think about our evaluation, our questions, and the data that we have. And it makes me think of something that we talked about offline that you brought up, which is the social model of disability. Because
Mm.
as Eric was saying, you know, COVID made like everything is a referral, like every single thing, right? It's like everybody's worried about our kids. And so can you tell us about that? What is the social model of disability, and how do you think that has changed things for referral questions and referrals and school psychologists and neuropsychologists as well?
Oh, sure. So we used to just have sort of the medical model of disability. Like a doctor could look at you and almost visibly see what was wrong with your body or your brain or the way that you acted, and therefore make a diagnosis of a disability. And people who met the criteria for a disability pushed back and they said, actually, I'm disabled by what you guys are doing around me. I'm disabled by the environment. And that led to the social model of the disability, which is that what happens in the environment when it is not inclusive, when it does not allow access, that's what causes the disability. That sometimes goes a little bit too far, right? People do really have things that are medically or statistically quite different about them, and in ways that may cause pain or discomfort. It's not just the fact that the environment may not allow access. So we've more come to something that's a little bit of an intersection where the difference belongs to the person. What's different about them is just it's something that's inherent in their makeup or their body or their way of thinking about the world. But the disability, whether or not it's disabling, is something that belongs to the environment. So, like the World Health Organization defines a disability as when you have a difference that limits activity of some sort of daily activity that's either important to you or is required of you in your environment that then limits participation. So the difference part is you. You like I can't see without my contacts in. That is just true of me. And whether if it limited my activity, if glasses or contacts weren't available in my environment, then it might limit my activity. And that's kind of an intersection of me and the environment. And then my participation is entirely dependent on the environment that I'm in. Is it inclusive? Does it allow things? So we are often, like, I'm often trying to find the difference in a child as part of my evaluation. But whether or not it's a disability depends on all kinds of things about the environment. A good example would be something like dyslexia. So I'm looking for the difference. Are there phonological processing differences in this child that are limiting his activity? Maybe reading is required of him in the school setting that he's in, which then limits his participation. That's not the same for every child, right? A child who is learning English, their phonological processing could limit their activity and then their participation. But in another language that doesn't, that's logographic, like Chinese, the phonological processing maybe wouldn't be causing the same disability, even though the difference belongs to the child. So that's sort of how I understand where we've kind of gone in terms of understanding what disability is versus the difference that the person has that they come into the world with.
Yeah, that's fascinating. And I wonder then if you'd think that a child, let's say, like the kids that we call twice exceptional, maybe gifted with a disability, what we're talking about in that sense might be like an intrapersonal difference, but it's actually not a disability if their strengths help them participate and engage, equally. Although parents or teachers may say, yes, but their potential, and that's where we get, into this complicated place where people want something more for a child who's doing really well in school,
Mm-hmm.
but because they're not meeting their potential.
Absolutely. And I think that's a question that we hear all the time of like, well, his IQ is a 125 and his reading is a 93. It's technically in the average range, but it's 2 standard deviations below. Does this, right? And we haven't yet defined what level of participation counts. So there is still some discussion around that. But definitely everyone, I think, can agree, okay, there's a difference in this child. This is definitely something that he or she or they struggle with. And it might be limiting some activities that are important to them, in the sense of maybe they really want to be an avid reader because they live in a world of words and they just really want to. Is it limiting their participation in the classroom? Is it preventing their access from moving forward? That part we kind of haven't decided. I think everyone has their own definition on that one still, right?
I'm wondering what your thoughts are with some of the discussion and debate about, the way we teach in schools, as far as, science of reading and math, and if we're using ineffective teaching strategies, if we're teaching in ways that are not conducive to learning. Are we creating differences? Are we creating disabilities? Like, would that not be a consider? We've had guests on that have talked about, that most kids that they're neurologically fine and they walk into a school setting, they're maybe not instructed appropriately, and then dyslexia or something that maybe it's not neurologically based. Is some of this created by an environment, and is that a disability? Is that not? Like, what are your thoughts on some of that?
Mm-hmm. Absolutely. And these are all such difficult questions to answer, obviously. So I'll just start there. And we all know that whole language and imbalanced literacy was such a well-meaning individuals trying to help children read in ways that it turns out do not help children read, at least help children read English. It may help in a language with a less dense orthography or something like that, but it doesn't seem to help children read English. And so children are being sort of almost actively disabled by their environment in some ways. And we do have a lot of kids who somehow still do manage to access the curriculum with that kind of instruction. And we have the kids who really aren't. And then we get into the question of, well, she's being instructed in the wrong way, but the rest of her classmates are making effective educational progress, or at least some progress. This child needs something different than what's available to every child. And so under the World Health Organization, that would be considered a disability in the sense of something in the environment needs to change. Some way of supporting that student needs to change because she's not able to participate in what is expected or what's important to her. Um, whether or not whether or not she even has a difference there is a little bit murky. But yeah, it's all very confusing in the sense that we don't always know the right way to teach children, and we don't always know that we're doing it wrong. But we know that some kids are making effective progress somehow despite that, and other kids need something more. So
Yeah, absolutely. And I wish that, yeah, it's so murky, like you said, because oftentimes the majority of the class is below grade level. The majority of the class is not making effective progress. And so you're sit there with this question about maybe this kid's referred and they're middle of the pack in the classroom, but they're below grade level. And all the, it's like, is half of the class disabled? And it's just, there's a difference in, who gets referred to us for testing and not. Some of that comes from parents, some of that comes from biases from teachers. And so sometimes, yeah, I see these kids that I'm like, yeah, they need help. At the same time, there's 5 other kids in the class that are even lower. Like, I don't know what to do. So it's frustrating.
Right. You're touching on all the important equity and inclusion issues of who gets referred. We know that there's a lot of biases in who ends up getting helped. We know that a lot of students are not making progress. We know everybody's behind due to COVID, and it's all really difficult to tease out. Part of what it would be lovely if we could do, if we were spending, we were talking about getting more thinking time. It would also be great if we all got more advocacy time, right? Where we could be spending some of our time saying, wow, every child in this classroom is just barely at or below in reading. Is there a way that we can support this teacher? Is there a way we could support this school? Is there a way we could advocate for the science of reading? And I don't have time to do that because I'm 12 reports behind, right? So part of it again becomes kind of the snake eating its own tail of like, we need to find ways to get more efficient so that we have more time to be able to help out on a where we're lifting everyone up, because when we try and just lift up certain students, we're going to end up just lifting up certain types of students. And I don't think any of us want to do that.
Yeah, that's really important. Something just through the discussion made me just wonder also, lately, I think in the last couple of years, we use the term neurodiversity a lot. I'm hearing it from parents and advocates and educators and folks in the psychology field. And I wonder, I think we use it a lot, at least I hear it a lot, for kids with ADHD, or I used to think of it as primarily for kids who truly had a neurological, and I don't want to say it, who had like a structural neurological impairment, agenesis of the corpus callosum, or, kids with intellectual disabilities, those kinds of things. So I hear it more for what I would say are perhaps less obvious disabilities. And so I wonder about that term, and would love to hear your thoughts about how truly neurodiverse are we? We're all a little diverse, I think, in so many ways, but are we neurologically diverse?
Mm-hmm. That's such a great question. And I will start off by saying that anything that anyone says on this topic is probably going to upset someone. So, and part of, I think, what is happening is that the term neurodiverse is a bit confusing. And it's so important to celebrate the differences that people come with and to reduce stigma and to allow all kinds of people to be authentically themselves. So we want that. And yet the word neurodiverse is kind of unclear. So that confusion, I think, ends up muddling things a lot. Because as you said, everybody's neurodiverse. When they've done studies where they just give people off the street neuropsychological batteries, most of them have a score that's really low, like 2 standard deviations below the mean in some area. Not something they were complaining about or knew about. They're just walking around diverse because we all are, just in the same way that no one looks alike, no one's brains are alike. They're the same in general ways and very different in the specifics. And we have found ways to label some patterns that we're seeing, although there's so many symptoms, right? Like there's so many symptoms for ADHD that you could meet kids who meet criteria who share very little in common, right? So even there's a lot of diversity. Same thing with autism, right? You've met one child with autism, you've met one child with autism. They may be very different. And we want to reduce the stigma for those kids. And they also often, the kids that we see, they're not just saying, "Oh, I feel a little bit different." They're saying, "These things are really hard for me. I have these real problems in my life. I'm in pain and uncomfortable a lot." Maybe because the environment is actively disabling them, but maybe because they're having a hard time reaching their goals. And so the medical model definitely needed to go. The social model sometimes has a hard time acknowledging that sometimes these differences that people have really do cause them pain or discomfort, or they may want support in that area, or it may cause their families a lot of distress. And right now it's all a bit confusing and everyone has great intentions and it's a bit of a muddle. That's sort of where I am on that. Where are you guys?
That makes so much sense. And I think that's a really good explanation. Without scanning everybody with fMRIs or something to really look for structural differences or something, right? We all have differences, but some of those differences cause people pain and distress, and
Mm-hmm.
and reducing the stigma around those is really crucial. So that was really well said.
Mm.
And then when you're mentioning things like, scanning everybody, I also feel like even if like there's so much that I feel like we don't know about the brain. Even if we scanned everyone, we would be like, okay, I don't see anything wrong there, but we just don't know enough to like, I don't know. I feel like
Right.
I look forward to seeing how technology advances to learn more about some of this stuff. I find it
Right. Well, that will be so amazing when there is some sort of multi-purpose scan that can really tell us all that unique individual information about a person. And now, like you said, the brain's a structural system, but it's also chemical, it's also electrical, it's also functional, and it's shaped by the environment. There's really compelling studies on the fact that we use other people to think and we use our bodies to think. So it's so complicated. And to pretend that we know more than we do, or that the whisk is going to tell us really exactly about that child's brain, right? It's seductive. I want to do it. The parents want me to do it. And we all have to just embrace just the humble place that we're in right now. Just like, wow, we really don't know.
Yeah, I find that so interesting. And then when I'm seeing in the news the things, all this stuff about AI going on, it's like we created this thing and we don't even know how it works. Like, so how are we going to understand what's going on here? I saw
Right.
something on Facebook, and I don't know the legitimacy of it, but that they were making headway in being able to scan and derive language, like a person that reads a sentence. I'm looking at the window, that they can do a scan and derive like the concept of window and looking and things like that. And I was like, if that's true, that's really cool. I mean, obviously there's so many ways that can kind of go wrong and amok, and it's just kind of the basics of it, but it's so interesting. It's so complicated that I'm just,
Right. And like every sci-fi story, you're like, oh, that's amazing. And they're a cautionary tale. And I feel like we're at that intersection right now of like, oh, that's amazing. And I can immediately think of like, wouldn't that be incredible for people who don't have access to words, that they could think and a computer could speak for them? Like the possibilities are mind-boggling. And every sci-fi movie is a cautionary tale for a reason. So how could it go wrong? And yeah, I think about
and
those
I
types of
think
things as
about
well.
like legal things and just using,
Yeah.
I mean,
Right.
yeah, but yeah, when you say, oh, and we have our whisk, and so
Yeah.
I think that, yeah, we make this jump of this whisk, and then we're
Right.
like, yeah.
And we know that our tests have bias built into them, not bias that anyone meant to put in there in most cases, but because of how they're developed. And with AI, we often don't even know how they're developed. When they are unsupervised learning, they are learning biases. And we can't even go in there and fix them because we don't know how it was developed. So, thinking a lot about the social justice and inclusion and diversity aspects of using unsupervised AI is keeps me up at night, right? Except
Yeah.
I would like ChatGPT to write my reports. That would be
Yes.
amazing.
My students asked about that this semester.
Right?
Not yet.
Not yet. It's not good enough
I
yet.
have
But
teachers that are putting in, getting ideas from goals. And what my husband is a teacher, and he's caught several children cheating, doing math problems and things. So it's something that it was like on an April Fool's, somebody posted on Facebook, like, ChatGPT, you just wrote my report, check this out. And I was like, and like I clicked on it because it got me. I was like, is this real? And I was like, oh man. It was totally like Rick Astley came on or something. Like,
right,
gotcha,
right. Yeah,
it's coming.
exactly. Yeah. I do a game night on Thursdays with individuals who identify as autistic, and we were playing 20 questions with ChatGPT, and it was so fun. And ChatGPT straight up gave us wrong answers. It was absolutely fine. Like we asked, is it an animal that lives in Africa? And it said yes. And so we kept going in that direction, but the answer was tiger. But it just confidently said yes. So there's a long way to go before these will write my reports, I think.
Sure. And I just want to mention, I have a cousin who works for Google, and they have their version, Bard.
Mm-hmm. Mm-hmm.
And when I was playing around with Bard and ChatGPT, I would ask it the same really difficult question, like
Oh,
from,
wow.
from psychology, and they would give me totally different answers. And then I would ask, which answer is correct? Like they just don't know what they're talking about. That's all.
Yeah.
Always
Yeah. Caveat emptor, right?
But Stephanie, I know we're coming up towards the end, but you have such a wonderfully warm way about you. What I really would love is for you to give us a couple of tips for feedback to parents after you've gone through the process, because especially if you know that the parents may not have, they're not going to get the answers that they wanted, or that it might be like difficult feedback for them. What are some suggestions you'd give us for that?
Well, one would be to focus on your warmth. They have done some great studies about how we all fall somewhere on the warmth versus competence spectrum. I naturally, if you've actually ever seen one of my Facebook posts, I actually go towards competence. Like it's like 15 paragraphs long. There's citations, there's links. It's horrifying, and I have to remind myself that a balance of warmth and competence really is the easiest to listen to, the most charismatic. It's the people that we want to be around. And when we go into feedbacks thinking nervous, we all go towards like whatever our wherever we are on the spectrum. And so I go towards competence, and I'm like, oh, I'm going to pull out the DSM, and I'm going to have all this expertise. And that almost never works. So instead, I go towards warmth, and I pull out stories, and I talk about emotions, and I talk about hopes and dreams and wishes. And I really try and do 65% of focusing on the emotions that are involved in this, and only 35% of the competence stuff of the diagnosis, the recommendations, the eligibility decisions, which I naturally want to go like 100% on, but I'm like, so I really try and remember that this is a very emotional process for families, and to consciously try and use stories, use emotions, and limit what I'm saying. So I always tell people, reports or feedback, I use this saying of 3 plus now what? Like you get to tell them 3 things, and then what's next? And I didn't like 3 is not my favorite number or anything. It's just our working memory can hold on to about 4 pieces of complex information. So you get 3 things plus what are we going to do about that? And so naturally limiting what you say, so that you don't go in there thinking, oh, this is going to be difficult. I'm going to tell them every single thing I know, including everything about statistics, everything I learned in grad school, everything I learned about this child. Right? I would love to, and that isn't where an effective way of communicating.
That's great advice. I love that. 3 plus what now?
Yeah.
I'm going to remember.
Okay, well, thank you so much for joining us. I know we're wrapping up. We're short on time. Everybody's quiet. I know we have audience people watching, but haven't seen any questions. But if you have any quick ones or comments, please drop them. I know that our next one is 5/21, and we have Dr. Faustino coming, who I'm sure will tell us about what we can expect from his presidency at NASP. So what we'll be seeing from him and his conference and all that good stuff. But any last comments, anybody? That was great. I just, like when you said like the warmth, Rebecca, I was like, yes, like that's, I'm feeling the warmth. I'm like, you just have a very soothing voice, and it's just like you explain things so nicely that I'm like, oh, it makes such sense.
Well, I just really appreciate you guys bringing me on, even for this sort of informal chat. We were kind of talking about like, what are we going to talk about? Well, whatever comes up, just so that we get the chance as professionals who have slightly different lenses to really kind of bridge that gap and realize how much we have in common. So I really appreciate this opportunity and getting to spend an hour with you guys.
Thank you. Thank you.
Thank you.
Thank you so much.
All right, everybody, have a good night and enjoy the coming week.
Yes. Good night, everybody.